Hi guys, my name is Lauren Ramirez and welcome to my genetic disorder presentation. For today's presentation, I will be presenting achondroplasia. I hope you guys like it. So the intro to achondroplasia. It's an autosomal dominant disorder that's caused by gain-of-function mutations. It's also contributed to be advanced maternal age, and it is also a de novo mutation. It's related to the mutation in the FGFR3 or fibroblast growth receptor 3 gene. FGFR3 encodes one member of the FGFR subfamily of tyrosine kinase receptors. Background and phenotypic features. This mutation induces a disturbance of the endochondral bone form. Most common rheumatological complications are medullary and radicular compressions due to spinal stenosis and deformities of the lower limbs. Spinal stenosis, it puts pressure on the spinal cord and the nerves within the spine, so you can imagine what type of pain they are in. Common features of achon include a short stature, shortening of limbs, arms, legs, upper arms, and thighs. Short and stubby trident hands, which increase the space between the third and fourth fingers, a disproportionately large head, and a prominent forehead. Phenotypic features part 2. Adults and children with achondroplasia may develop bowed legs, abnormal curvature of the spine called kyphosis and lordosis, and they can also develop new or more severe spinal stenosis, as we talked about in the previous slide. So as you can see in these 3 pictures at the bottom, the first 2 pictures are people with achondroplasia and the abnormal curvature of their spine. And so you could imagine how they would look or what type of pain they would be in if they're standing, sitting, or just what type of pain they would probably be in walking. And the last picture is an x-ray of someone with bowed legs. So you can see how they're curved out, so you can imagine how that would affect their walking. A quick case study. So for this case study, the gender and age is a female. She's 7 years old. There was a deformity of the chest, which was noticed at the age of 5 months. She was treated for rickets at 16 months, which may have led to a growth stunt. She also had a short trunk, extreme laxity of the wrist joints, but she did have a good enough grip. And her lower limbs were very slightly affected. So in showing the case as one of achondroplasia, it wasn't meant to suggest that it was a typical of achondroplasia, but the case would be placed in the achondroplasia group. Diagnosis and natural history. So achondroplasia can be detected and diagnosed before birth by a fetal ultrasound. DNA testing can also be done before birth to confirm that fetal ultrasound. If the child is suspected to have achondroplasia, it could also be diagnosed after birth with a simple physical exam. So in these 2 pictures, there's an ultrasound of a baby with achondroplasia at 32 weeks. So as you can see, she or he may have a shortened femur, as you can see. And there is also frontal bossing, which is just a fancy way of saying a prominent forehead. And in the other pictures, there are multiple pictures of a baby with a large head or a prominent forehead. And you can also see that there are a shortening of limbs in some of those pictures, and also a picture down at the bottom left of a curved spine. It might not be a huge curve, but there is still a slight curve in their spine. As for treatment and cures, as for right now, there's no cure for achondroplasia, sadly. Depending on the severity of the child's case, there may be a possibility of surgeries to correct the problem or area of pain. So people with achondroplasia may go through about 10 or 15 or even more surgeries before they're 18, just to correct, their bowed legs or like the spine curvatures. So they do have that short stature. So having a curved spine and the bowed legs and not having a normal sized body does cause a lot of pain on them. So you can imagine how many surgeries and how much they have to go through just to feel okay, even with their short stature. So there are also standard therapy treatments to address the individual symptoms as they may progress. Inheritance risk. About 20% of cases are inherited. The mutation follows the autosomal dominant inheritance pattern, which means only one parent needs to pass down that defective FGFR3 gene to that child. If one parent has achondroplasia, the child has a 50% chance of inheriting it. If both parents have it, the child has a 25% chance of a normal stature, 25% chance of inheriting two defective genes, which would result in a fatal form of achondroplasia called homozygous achondroplasia. In these two photos, there are two families. The one to the left, they are the Johnstons. Both of these families have shows that talk about their lives with achondroplasia. It's actually on TLC. So, as I said, to the left, those are the Johnstons, and to the right, those are the Kleins. The Johnstons, Amber and Trent, which are the mother and father. Amber, she has both average-sized parents, and Trent has one average-sized parent and one parent with achondroplasia. So they had two kids of their own biological children, and they both came out with achondroplasia, which are Jonah and Elizabeth, which they are the two in the back. So then you have Emma, she is from China. Anna, she is from Russia. And Alex, I believe he is from China as well. So they adopted them because they were born with achondroplasia, and sadly, they were given up because they had achondroplasia. So this family, they're awesome. They have most of them have their own businesses. They do activities as if they were average sized people, and but they do in their home, they do have everything that would be for an average sized person. They wanted to teach their children to adjust to average sized things in their home, because if they were to go out in the real world, there wouldn't be things adjusted to their height. So they did want to teach their children that, which I think is amazing. As for the Kleins to the right, they both do have achondroplasia, and both of their parents are average sized. So the mother, she went through so many surgeries as a child, and like I said before, imagine the type of pain and the type of things that they have to go through just to feel okay. They did adopt their two kids, Will and Zoe. They were also given up for adoption because they had achondroplasia. So they try to teach their children to be okay with being a little person. The phylogenetic tree. So you can see Homo sapiens, or humans. That's a picture of me. You can see that I did a few pictures of monkeys that were closely related. Then I went to a beaver and an elephant, and then a killer whale and a bottlenose dolphin. So you can see how this phylogenetic tree goes from one type of species to a total opposite species. And here are my citations, and thank you for watching. I hope you guys liked it.